Voy a dar paso ya a Ana Larraín, que creo que está conectada para...
Well, thank you very much, and we have our moderator online so that she can moderate the questions. And well, if there's anybody here in the room that has any doubts, we'll give you the microphone. Just put up your hand. Anna, when you want, go ahead, okay?
Bueno, muchas gracias a todos los expositores.
Yes, very good, nice presentations, quite deep, and very general thread in the questions, asking for help from the different countries, and also a great interest in connecting. From that perspective, I first would like to thank Dr. Duane. She invited us to register to her courses, and I think this is going to be a very good opportunity. To Dr. Ecochard, who gave a fantastic presentation, would like to address this question. How do we take into account this new paradigm, this renewal of medicine centered in love and life? How do we bring it to the healthcare providers, to the schools of medicine, the schools that form doctors and physicians and midwives? How can we bring this teaching to them? Dr. Ecochard.
Thank you very much for this important question. So I am teaching at the university, at the public university, so I understand this point. I have experienced. So my proposition is first on vocabulary. Always use a choiced vocabulary, true words. Never speak about love without speaking about life. Never speak about the fertility of a woman without speaking of the participation of the man. And you know, if your vocabulary is progressively plenty of life, students ask for it. When I speak at the university to my student, to the gynecologist, they come at the end of the course and ask me many questions. So I think that we give hope to people speaking of life, including always love. And so never accept to just limit to a mechanical aspect. The second is to always respect the two action of hormones. Hormones do not act only on the body, they also act on the brain. And so it is very important to include always the brain action of hormones, because hormones have human effect. So the reason to avoid hormonal treatment, or to select hormonal treatment correctly is due to the fact that hormones are modifying the life, the psychology, and the relationship. So first, vocabulary, and second, to speak really correctly about biological aspect, not limiting biology to uterus or to, you understand. And people are very enthusiastic when you speak with this respect, I propose.
Gracias, Dr. Ecochard.
Dr. Ecochard, very encouraging and very hopeful, everything that you say. Along that same line, we ask Dr. Duane, who also gave us a lot of hope. She said the sky is a limit when there is no limit. How do you face in your courses at the University of Washington, how do you deliver the anthropological setting in those courses that are given to students that take healthcare courses or courses on?
Since I don't have the live stream on, I want to ask if you could translate it into English so I make sure I fully understand what you're asking. Could you repeat it in English, please?
Okay. The question is do you give an anthropological, philosophical context to your students, or is it just evidence, biological evidence? And in that same, okay, go ahead.
I think that is a great question. When we first began teaching the elective, we did give more of an anthropological, philosophical approach. We even initially in the first few years that we taught the elective, we did a discussion on Humanae Vitae, since Georgetown University is a Catholic medical school. But we found we received a lot of pushback on that. And we have discovered that in order to reach more medical students, it has been most effective for us to focus on the science. We do talk about it in the context of the relationship. And to Dr. Eckershardt's point, we highlight that hormones are not merely biologic in nature. They do not only affect the physiology of the female, but they do affect the mind and mental health. So we do try to incorporate more of that in the lectures. And during the case discussions, we have leading experts in the field that present and will present about it from the patient perspective. So while the focus is primarily on the science, we've chosen that route because we found we've been able to reach more medical students with this information. But when they have questions or if they want more, we find the exposure to physicians in practice and patients that use these methods help them to really understand it from an anthropological approach.
Gracias, doctora.
Thank you very much, Dr. Duane. There is another question. If you train instructors for fertility recognition, awareness, you have the follow-up of the cycles. What is the method used in the follow-up of the cycles? Another question, another person asks if there is a link with the institute in Omaha. I didn't understand the second part. Well, if you can repeat in English, I would like to be certain about it.
What method do you use when you do a cycle follow-up with your students? If you have any relationship with the Pope 6 Institute, and also, are you preparing students to become practitioners or instructors?
That is an excellent question. So personally, I myself am trained as a Creighton medical consultant, as well as a FEM medical consultant and a neofertility medical consultant. So I have completed training in all three of those programs. I have also personally completed training as a Billings instructor through the Teen Star program to educate adolescents. Through our course, our goal is to provide a foundation about all of the methods. So we provide basic introductory instruction in Billings, Creighton and NAPR technology, standard days, symptothermal, Marquette. With my patients use a variety of methods, and it really depends. Some patients come to me and they've already been charting with the symptothermal method or with Creighton. Depending on their goals, I may refer them to use different methods. So yes, to a certain degree, I do have a relationship with the Pope Paul VI Institute, and we teach about all of the methods. To the second question, do we train people to be consultants, to be medical consultants? The way I describe the role of FACTS is we really provide that foundational understanding. Our goal is to reach medical students who really only learn that birth control is the best thing for women. In medical school today, they learn that the pill is the panacea for all that ails women. They do not even learn the basics of charting, and so they wouldn't even consider pursuing a training in Creighton at the Pope Paul VI Institute or through other organizations because they don't understand the basics. Our goal is to provide that foundational knowledge to help them understand the basic science underlying these methods and the broader applications. Once students complete our training, we encourage them, if they actually want to use these methods in practice, if they want to understand the protocols, we recommend they consider pursuing additional training either through the Pope Paul VI Institute, through the Reproductive Health Research Institute out of Chile, which is offered in the United States through FEM, and or through Neo-Fertility, which is offered through Ireland. So our philosophy is the best natural method is the one that works best for that patient or that couple. And that's going to vary from patient to patient and couple to couple. And so we believe they should be given information about all of the methods that have solid scientific support for their use.
Muchas gracias, Dr. Duane.
Thank you very much, Dr. Duane. It has been very clear. Thank you very much. Another question for Dr. Maria Elena Allende. Thank you very much for your presentation. There is an interesting question from Isabel Cárdenas. If you have considered and incorporate to your team nutritionists, bearing in mind the importance of nutrition of the body upon fertility of the woman. We have in one of the centers in San Bernardo a true nutritional problem. We have a pandemic of obesity that is very complicated. The truth is that as we have even more patients who come looking for a pregnancy. From those before, we had more patients who wanted to distance the pregnancies. But today, the situation has changed somehow. Yes, the persons who have some problem that need to change their diet, the first thing they have to try to do is to go down in weight. We have many polycystic ovaries that may be associated to metabolic syndrome. So yes, it refers to nutritionists, but it's not envisaged within the group that there is a nutritionist in the group. It would be a little bit too much, she said, but it does refer to this situation, yes. Thank you. Dr. Allende, another question that has to do with this evolution that you told about the method itself throughout time. What is the advantage that you see to this method, the current method that is being used in our university with respect to the Creighton method? Well, I think that if any physician sees a Creighton book, has to be initiated to understand the letters that summarize the fertility, the card of Creighton. This should be self-explanatory due to the didactic problem issue for the users, and also to know that this is going to be helpful as a tool for monitoring and diagnosis, so that they can be used by the physicians. Through the program, we have the students that go through this program, and they do come out with a notion, knowing how to read this card and saying what it's all about, etc. And this is facilitating things. What is the practical experience that we had? If you'd ask me what is the advantage or not, one of the persons who joins our meeting made the following comment. She was trained in Creighton, and she trained with the Creighton model. But she thought, could I use your card and she told us a few meetings ago that she saw a difference as soon as we started using. It's simply a way of recording. We haven't added nothing else, or not too much. Well, the issue of the intention, the desire, etc., the issue of the suns and the moons, we have realized that it's very interesting to assess the effectiveness. These are issues that suddenly appear and that we don't take too much into account. But yes, to using these letters, to have them in the same card, put the most fertile in the upper parts to be able to make the summary, simplify so many words. When we put crosses, and we eliminated the issue of 50,000 feelings. I myself, when we were working at the model of the University of Chile, I invented many reasons because I thought it was the best thing to use. Now, as we get older, we become minimalistic. So I myself wanted to aggregate more issues. What's the idea? The important thing is that from the very beginning, the person knows where the fertile period is. And to tell me if I'm fertile or not. Why are they inventing more things? That's why we reached this issue of the range of sensations and feelings, and also the degree of transparency. Why put colors and 50 names when the only thing that is important if it's going to be fertile or not? This has to have a degree of transparency. That's all. That's the advantage that time has given us. Thank you very much for your explanation. Interesting. Certainly with years, we become wiser. Thank you to the three of you. We are not going to be able to have more questions, and I think the emails will be available for you to write directly to them. I give the floor now to Cristina Alfaro so that she closes this panel. Thank you very much, Anna. Thank you, Dr. Duane. Greetings to Chile and Washington, and also to all those people who have not received any answer. There are many questions that have been asked, but they will not be forgotten. They will answer them. This Congress has to be alive. It has to stay with the time, and from which we will have many conversations that will arise, and more research and more help to so many countries, Congo and Ecuador, that have asked questions, and we haven't been able to answer it, but it will be answered as soon as possible. Thank you to both of you, and thank you to René and Maria Elena for being here today. Thank you to the organization for having us here. And that's all. We're going to give the word to the Archbishop of Burgos. We don't want to make him wait. And I have to go rushing because I have a baby 12 days old at home. And all these issues are very interesting for me, and think that the whole society at large, not only the medical scientific world, has to be more informed about natural fertility, that no doubt is a world yet to be discovered, and something very good for the whole mankind. Thank you very much, and see you in the next occasion. Thank you.
A kiss to your baby.